Doctor, I've watched one of your videos whereby you talk about problems faced by those who have flat foot. Yet I know a group who are born with a flat foot. What happens to them?
That's a very good question. Yes, when we are learning to walk, the motor control center programs our cells. When a baby is starting to walk, there is a lot of falling and getting up, and you master. So your body masters how you will be walking. That's why you find there are some people who are born with polio and they have had no body challenges all their lives. So if you are born with a flat foot, your joints in the body will adapt to depending on the way you are going to master walking. Your foot might not undergo there will be limited ranges of supination and pronation of the foot, like the way the foot turns, and even the shock absorption will be programmed. The motor control center will program. It's a part of the brain that's responsible with planning our movements. So the motor control center will program your movements and the way you'll be moving throughout your life. So it is very possible for you to have a flat foot if you were born with a flat foot and you don't experience anything like pain, because there will not be structural adaptations in your life as you grow up. But if you are not born with a collapsed foot, if you are born with an arch, it means your movements, your rotations, or your chain reaction was built based on that arch. If the arch collapses due to poor footwear, walking barefooted for long hours, putting on sandals all the time, and your foot collapses, it's going to affect your chain, because the motor control center did not design your movements with a collapsed foot or with a flat foot. Unlike the people that were born with a flat foot, and you will find that now the people that were born with a flat foot, if they try to put on shoes with an insole to try and create an arch, they might feel pain, because their motor control center from when they were young, when they were babies, and they were mastering walking, they were not born with an arch. So the body organized the movements without them having an arch. So their adjustments, their structural adjustments and joint adaptations to load is different from someone who was born with an arch. So it's the collapsing of the arch, it normally causes pain when you are born with the arch. And you can have pain if you are trying to create an arch when you are born without an arch.